Welcome to More Than Miles, the podcast where we use storytelling and expert interviews to widen the lens on what it means to be a happy and healthy endurance athlete. We believe that athletes are so much more than their body, sport, and training miles. I'm Dr. Kate Edwards.
And I'm Dr. Kacy Sinders. We are endurance athletes, physical therapists, and huge coffee addicts. We spend most of our time treating, educating, and working with endurance athletes. Thank you so much for tuning in today. Now let's get to the show. Hello, everybody. Welcome to More Than Miles. Kate and Kacy here to talk about some bone stress injury. And we're really excited to kind of delve in a little bit deeper because this is piggybacking off of our previous episode with Dr. Courtney Gleason. So if you haven't listened to that one, we both highly recommend going back and listening to that one. But first, Kate, I want to know, how are you?
I'm good. I'm at the beach.
I know, I'm very jealous.
Yeah, you should be. It's beautiful out. I just love to hear the sound of the ocean. So hopefully it's not distracting in the background, but I don't think you can hear it. It's sunny out and I can see the waves. So it's good. And today my earphones are working, even though I dropped them in coffee.
Which, by the way, guys, when we started recording, this is the first thing Kate told me. She didn't say hello. She said, I dropped my earphones in coffee, which is a very Kate Edwards move. So
no, it's good. How about you? How's your day going?
It's good. As you know, Tuesday is my day off, but it's also known as my administrative day and podcast day. But it's also a day I get to pretend like I'm a professional athlete. So I work out and exercise quite a lot, and I enjoy that lifestyle. So it's been good. It's quite sunny and warm here too. So that is nice. For spring is springing, as they say.
Such a nerd.
Oh, I know.
I would just like to mention you have a really awesome boss that allows you to have the whole day off to pretend that you're a professional athlete.
It's true. I'm truly blessed. Sometimes I feel like a chosen one with this boss that I have.
Well, you probably deserve a whole day off with all the things that you get roped into, like podcasting and side projects and all of your creative names for everything that I text you about at really ridiculous times during the day, night, morning.
Yeah, you guys. So Kate texted me, I think it was last week, and you were like, what are 5 things that every runner should have? No context, nothing. And of course, I'm like, my brain is like going all over the place. And I'm talking about like my favorite sports bras and shorts and like no idea what this was. None of that ended up being appropriate for what she really wanted. But these are the kind of texts that I get. And, you know, I wasn't going to say it, but I do think I deserve a full day off.
You definitely do. Yes. And then I also, you know, my coloring book, my runner's coloring book is going to come out soon. And so I've been texting Kacy randomly throughout the day about helping me name it because she's more creative when it comes to this. And she's given me several good names. I'm very excited to pick one.
At your service. These are my hidden talents.
I don't think they're hidden. We're announcing them.
That's true.
Wait till she puts out a jokes book. That's going to be my favorite.
I'm very, very excited for that. I already started thinking of some jokes on my run this morning. So,
oh, good.
Anyway, I found myself on Saturday typing things into the note app on my phone because I was coming up with ideas.
Well, I'm very appreciative for you and your brain. All right. Well, let's actually talk about some bone health stuff. And I do want to say that our conversation, you mentioned it already, but our conversation with Dr. Gleason was really great. And she is just such a wealth of knowledge and really fun. And I love that podcast. I think it was good. So why don't you give us a little recap for those people that may not have heard it, and so that they have some kind of reference as to where we're going with this episode.
Yeah, sure. So the two biggest topics we sort of broached with Dr. Gleason were Red S and then menopause. So Red S, if you're not familiar with the term, it was formerly called female athlete triad. Red S stands for relative energy deficiency in sports. And so what this does is it expands the definition of the issues we see with energy deficiency and brings it into multiple systems and then brings it into a neutral gender because this affects both men and women. So The female athlete triad was talking about this relationship between energy deficiency, bone health, and then loss of regular menses or amenorrhea. And it goes way beyond that. And so as this research has continued, the scientists and the collective medical community decided to start calling this red S. And so we talk about the hormonal kind of impact that energy deficiency has and how this leads to issues with bone health, increased risk for stress fractures. We talk about what sort of diagnostic tools and what kind of things that Dr. Gleason is looking for in the clinic and how she helps these people. And ultimately, it means bringing in multiple different practitioners. It's a multidisciplinary sort of solution for most of these athletes. And so we talk about that, and we get into running culture. We actually end up talking about a lot of different things that impact why people get bone stress injuries. And so that was a really, really great way to kind of kick off the podcast. And then we finished up talking about menopause and hormonal changes that occur with menopause. So how do I adapt for those changes in hormones, how to change your training, what's going to be the best way to sort of gracefully go through this transition period, because it's just like any other time, particularly in a woman's life when hormones are changing, it can be quite jarring for the athlete. And so we talk through that. And, I think the coolest thing about that is I don't think we talk enough about really either of these issues, but particularly menopause. As Dr. Gleason mentions, it's a universal part of any woman's life. Everyone goes through it. And yet we don't talk about it and how to kind of cope and go through it in the best way. So a lot of really good information there. So you guys should go back and listen to that one in addition to this one that we are recording now.
Yeah. And I think we definitely have to have somebody, another person on to really go into depth about menopause another time, just because it's such an important topic. So we will definitely do that. And of course, as always, if you guys have questions or specific questions, you should send us an email, let us know so that we can address them on the podcast. But let's move on. So let's talk about why does bone stress injury occur? And so I think the first thing that we should talk about is this energy availability piece, because I think of it as a math problem, really, because it is a math problem and it's the easiest way to think about it. It's the amount of energy you're putting in minus what you're putting out equals your energy availability. And it's that easy. That is it. So what it means is that if you are increasing your uptake or your output, so you're increasing your mileage, you're training more, whatever you're doing, then you also need to increase your caloric intake so that you have enough energy availability in your system to be able to do what you want. And one of the things that we talk about in the last episode, but that we talk about when it comes to red S and bone stress injuries, is that if you don't have enough caloric intake or enough energy to satisfy your basic needs to your body to function, then you're in serious trouble if you start adding performance on top of that.
Exactly. And this doesn't take much of a deficiency. So if we think of if you're on most days averaging a 200 calorie deficiency, that is going to lead to a net deficiency that's going to affect your performance. So it doesn't take much, and this balance can be pretty delicate for some people, especially for those of us who are training long hours and spending a lot of time active throughout the week. Another thing that we did touch on is sort of the two different kind of ways that people come into this. One being sometimes it's just lack of knowledge, or they have a big change in their activity levels that all of a sudden require a lot more intake to balance out their increased expenditure. And it's just a knowledge problem. And once, they have a little bit of education, maybe have a nutritionist on board, we can really see some positive changes relatively quickly. And if it's just a knowledge problem, that's ideal. There's another component to this, and this can come into the realm of disordered eating. There's so many different ways that people can struggle with this, or where it comes from, or what kind of messaging has led to someone to doing this. Running culture and any sort of athletic sport, or, on the men's side, wrestling with, making weight being important. There's so many things that can cause someone to sort of go down this road of restrictive eating. And it goes beyond just meeting their performance, there can be a lot of emotional load there too. Mm-hmm. So just important to recognize that, not everyone who has RED-S has an eating disorder, and not everyone who has an eating disorder has RED-S. They're not mutually exclusive in that way.
I actually find, Kacy, that a lot of people don't really know how to fuel for performance and don't know how to fuel for activity. And so I do think you're right. There are these two groups, and they're two large groups. And oftentimes that education is so useful because for the group that really doesn't know, they really don't know. And nutrition is a basic need. I'm always talking about with the elite athletes and with my athletes that we have to meet our basic needs before we can actually get to the point where we're not injured and we're performing well. And nutrition is definitely in that realm of basic needs. And if you're not getting the right nutrition, there's no way you're ever going to perform at a high level for a long time. You might make it for a little while, but you're inevitably going to get injured. Something's going to happen that's going to take you out because your basic needs aren't being met, and specifically in the nutrition area.
Yeah, completely agree. I always remember the analogy of you wouldn't put unleaded gasoline in a Ferrari. The idea of you have to put good stuff in because you're a high performing athlete. You're a high performing person. And so you want to put the best in order to get the best out of yourself. Take it with what you will. Sometimes that analogy works for people and sometimes it doesn't.
I love that analogy because I am totally the person that would put unleaded gas in a Ferrari. I'm just saying that because I don't.
But it's cheaper.
It's cheaper. I love that analogy, and it's absolutely right. When I was training for marathons, I actually saw a dietitian and was told I need to eat more to perform better and to lose weight. And then when I did eat more and I was working with her, I actually lost weight and performed better. So it's actually sometimes you don't realize it, but more is better.
Mm-hmm. I would say more often than not. And I've had a similar experience too, where, because of my past with eating disorder, I had these ideas in my head of how much I eat normally, and changing those ideas was difficult. But once I kind of expanded that and actually tried to err on the side of eating more is when I really noticed a good difference. And I've heard a lot of athletes have similar experiences working with dietitians where they're like, hey, you've got to eat more. And it's usually carbs, protein, really all across the board, but it's usually you have to eat more. And, I do think that it's important to recognize too, that not all bone stress injuries have an energy deficiency component. There can be some training error or some other reason why someone's bone health isn't ideal, or some other reason why that particular area in their body has taken on some undue stress. It is common, but it is not the only reason why people get bone stress injuries. So I just wanted to make that disclaimer as well.
Yeah, I think it's something we have to rule out, but once it's ruled out, we can go in other places. I actually treated an athlete with a bone stress injury not too long ago, and I worked with Dr. Gleason on this particular athlete because she did not have any signs or symptoms of RED-S and passed all of her tests. And when we looked at her, I did a gait analysis and looked at her biomechanics, and it was very clear that it was actually biomechanics that caused the bone stress fracture because of her landing pattern and how she was absorbing force with every step. And so it doesn't have to be RED-S for sure. But I think that it's important that if you have a bone stress injury, you do get screened for that, because either you don't understand you may not understand your nutrition aspects and your energy availability, or there might be something else underlying, like we said before. But if you're screened for it, you also have to know where else to go. And physical therapists, particularly that specialize in running and run gait analysis, can be really helpful when we're looking at that other side of bone stress injury.
Another big population where we see bone stress injuries is new moms returning to run postpartum, obviously, or maybe not so obviously, actually, because side note, I am always trying to educate and spread knowledge on Instagram. Most of my Instagram is supposed to be funny, but I mean, sometimes I just get on a soapbox. And so I was posting a sort of list of things that increase risk for injury postpartum. And of course, breastfeeding was on that list. And someone DM'd and asked me, or direct messaged me, and asked me why was breastfeeding increase their risk for injury. And, so some of this does have to do with the energy component, how much energy it takes to produce, enough milk for your baby. But a lot of it has to do with the calcium withdrawal from the bones. And I know you're more of an expert on this, so I can't believe I'm the one who took on this bullet point.
I love it.
I think I'm doing okay. The biggest factor here is not only the energy imbalance, and then the calcium loss from the bones.
That's right. And I think you did great. The other thing is that when you are breastfeeding, and I've said this on other podcasts talking about postpartum, but you need an additional 500 calories a day if you're breastfeeding and you are exercising, if you're breastfeeding in general, not including the exercise. So it takes an additional 500 calories a day just to produce enough milk for your baby. So that's really, really hard, particularly for athletes postpartum, because postpartum is a time when it's a transition point. And we talked about how transition points are really hard. And typically when you are postpartum, you want to shed the weight that you put on. And it's a time where a lot of psychosocial things come into play. I know that I struggled with that as well. I actually knew that you had to have 500 extra calories a day to produce breast milk. So I was aware of that, but I really loved that you burned so many calories breastfeeding because I got really skinny. And that's the truth. That's just a psychological thing that happens. And if we're aware of it, it helps. But we also have to realize we are not going to perform well, and we probably will be injured if we don't replenish that balance. I ended up with a stress fracture, of course, for multiple reasons. One, because I wasn't fueling properly, but two, I was overtraining. So I had both things going for me.
Yeah. And I mean, we see this, the professional running world as well. Some new moms getting pushed back into competition too early. And obviously with the intensity that they train, it's just really tough to balance that milk production and intense training from both a physiological and, of course, bone stress perspective.
A lot of people decide not to breastfeed because their milk, quote, dries up because they're performing and under a lot of stress. And that's fine too. If you decide not to breastfeed, that's fine. But you still have to understand that if you did at all, it takes a while for your bone to replenish. So just because you stopped breastfeeding last week doesn't mean you're not at risk still for bone stress injuries. You have to wait at least 6 months to a year till you're really in the clear.
Yeah, I was going to make sure that we brought out that little fact there, because I think that's important for runners to know how long it takes for bone to replenish and truly for you to be back up at that full bone density you were pre-baby.
Mm-hmm. So let's kind of talk about signs and symptoms of bone stress injuries, because I think if you understand that it's a possibility, you may not know what it feels like. And if you do know what it feels like, you may ignore it for a little bit because you don't want to stop. Back to that psychological component of return to running. But can you give us a little bit of the signs and symptoms of bone stress injury and also the levels of bone stress injury?
Sure. So bone stress injuries can be very obvious and they can be very sneaky. They kind of present differently in a lot of different people. The first sign is muscle tightness around that area, or it's just something that feels like, something that people have dealt with before, where it's just, oh yeah, my calves always get tight when I marathon train, or my glute always has this trigger point in it, things like that. And, eventually it will progress to where it's more pure stress fracture signs. So when we talk about stress fracture signs, we're talking about a sharp or aching pain near a bone. And we'll talk about locations here in a second. That increase with weight bearing. Now, this can be weight bearing in terms of actually impact, so running or impact related activities, depending on your sport, but also can progress to just in general having increased pain when you're on your feet. And this is usually the sign of a little bit more progressed stress fracture or stress reaction. They can be a little bit tricky in terms of how they feel to the person, but usually we're looking at localized and a sharp pain. And this gets a little bit easier to diagnose, I think, below the knee and a little bit higher above the knee, just in my experience. I don't know if you've experienced anything different, Kate.
I think it's more cut and dry when it comes to like tibial or fifth mat, and it's not as cut and dry when it comes to femoral or lumbar sacral.
Yeah. And so another thing as a clinician that I think that can be a telltale sign of a stress fracture is if someone comes in with some sort of pain complaint and you treat it, you work on all the trigger points, the fascial restrictions, the mobility restrictions that you think might be causing pain in that location, and they feel better, but then the same problems come right back once they start running again. Or if someone has pain somewhere, they take, depending on your runner, sometimes people think that 2 days is enough time off. But let's say that this person's a little bit more cautious and takes a week or two off from running. Like, oh, I feel better, have no more pain. And then they go run and that pain comes right back. Usually that is a telltale sign of a stress fracture.
Stress fractures can be sneaky. So sometimes you'll be treated often or multiple times. And then if the symptoms keep coming back in the same way, you're in trouble, especially if the symptoms are in that kind of outside of the hip or groin area, because that would be more like a proximal femur stress fracture. If you have it in the sacrum, you might have it more in your lower back or your butt. And lumbar is you'll feel it in your back. And then fifth mat, you'll feel it in your foot. And then in your tibia, your shin. So those are kind of the main areas and most common areas that runners have stress fractures. But it's all about whether or not it comes back and if it increases with more weight bearing. So when we're talking about like a tendinopathy, you might start with pain. And as you run, it gets better. And with a bone stress fracture or injury, you might start with no pain and the pain gets worse as you run. So it's opposite. And then it might be to the point where you're limping and unable to walk if you keep pushing yourself and going up and down stairs, things like that.
And I didn't really speak too much to the degrees as you'd asked me to with the previous question. But I mean, there's definitely a spectrum here. And so all stress fractures begin with some sort of stress reaction to the area. This can happen through just the way force is passing through that bony area. And then also how the muscles pull on the bones and create a certain amount of stress as well. So I think the easiest way to visualize this for maybe folks listening at home is with tibial stress fractures. So we have all kinds of muscles that sort of line the tibia and they're fascially connected to the tibia. So every time we use those muscles in a certain way, it's going to pull on the bone. And so one thing that you'll commonly read if you Dr. Google shin splints is that it is a pulling and irritation of the muscle tendinous junction as it's pulling on the periosteum or that most outer portion of the bone. And that's literally the definition of shin splints. So if you think about shin splints, it's actually a very early bone stress injury precursor, right? Yeah. So we can have something like that progressing to a stress reaction where we'll actually see some bony changes beginning. And so we'll talk about diagnostics here in a second, but where we'll actually see changes in the bone that is progressing towards a fracture. And then, of course, we can have all kinds of different degrees of fracture depending on the stubbornness of the athlete and how much they run through it.
The more you push through it, the harder it is going to be to recover and the longer you're going to be out. So if you have shin splints, that's a great time to start getting treated so you don't end up with a tibial fracture. And shin splints and tibial fractures can occur with gait mechanics. It might be that easy. So you might, a lot of people with those types of stress reactions that aren't related to RED-S often have, a very narrow base of support and they need to widen that out, or they might be landing on that outer part of their foot or in a lot of supination or just inverted quite a bit. So diagnostically, the way that we find bone stress injuries in the clinic, we will do jump tests. So we'll have you doing, they're called hop tests. I call them jump, whatever, hop tests. So we can see if somebody is hopping in place on one leg, if that's creating some symptoms. We use our hand to actually push on an area, and you can usually feel if you're we'll use the tibia as an example again. If you're in the area and you're pressing all along the bone and there's no pain, and then one point that's really painful and then no pain, that's likely an area of some kind of stress reaction. I don't really use this much anymore, but there was some research in the past about using a tuning fork to find the stress fracture or stress reaction. I usually use that in group of everything else. So I never use that alone. But then in terms of other diagnostics, it would be like x-rays and MRIs. The thing to be reminded on with that is if you just got a bone stress injury, You probably won't feel it a whole lot initially, unless it's very, very bad, unless it's an acute fracture. And if you do an image too soon, before that 7 to 10 day mark, it might not be picked up on imaging. So if you go and get an image, they may say you don't have one, but you might actually have one. It's just that the image can't pick it up yet.
Yeah. And in some cases, we won't see anything on the x-ray, even though there are the beginnings of a stress fracture. And I do struggle with this because I know how annoying and expensive MRIs are, but they're truly, truly the best way for us to know what's going on so that we can advise patients properly.
Yeah. And I do find that I wait if I think somebody has a stress reaction or a stress fracture. We'll do all the other tests. We might back off their activity and send them to the physician. And then we decide together with the physician, a lot of times, do we need to do an image or not?
Likewise. Yeah. You want to be sure if you're going to send someone off for an MRI for sure. Let's talk about rehab a little bit. So this is our realm and what we do and how we work with people who come into the clinic with bone stress injuries. So obviously it depends on where they are in terms of, are they ready to begin a return to running program? Are we working on the aspects of mechanics that we can work on prior to weight bearing, so on and so forth? People come to us and they've waited out. Let's say they've been cleared by their physician. They have a clean image. Now, where do we start back?
If you have a bone stress injury, it doesn't mean you can't do PT, because a lot of times it is biomechanical, it is strength-based. There are a lot of reasons and things that you can work on, even if you're not directly working on that stress fracture. But we might be help with increasing core stability or hip strength or all of those things that go together with the injury while you're in a boot or on crutches, whatever.
Right. Yeah. And so you can get a good program or at least something to focus on while you're in that waiting game, because it can be particularly tough. And I know for a lot of athletes, they like to feel like they're progressing or they're working towards something. And sure, the whole process is, I have a lot of choice words for it. I know it really sucks. It is not fun. But having that early contact with a PT before you're ready to run, I think can be really, really beneficial, like you said. Once we get back to that point, so once we feel confident about symptoms, about bone healing and all that good stuff, where I usually like to start is with a series of plyometrics. And there's a few reasons why I do this. I start here because even though we have a clean image and by all markers, things should be good, it gives us a little bit of a window into how the body's going to handle impact. So we can observe and see if there's any lingering soreness, any soreness with activity. And so we can pick it up earlier, like before I just send them off to run, we can see and make sure that, okay, I think a return to run program is going to go well at this point. So that's one reason why I do it. The second reason why I do it is to help kind of start build that resiliency and elasticity and recoil of the tissues after such a long period of not having that stressor to the system. The programs that I set up for people is going to depend on how long they were out, what their level is as a runner, what they're looking to get back to. So I'll tweak it some. This is usually a combination of double leg jumps, single leg jumps, and then some sort of lateral movement, or just to introduce different types of stressors to that location. Any other place you start, Kate?
No, I was just thinking what a good PT you were. Yes, that's exactly right. Because the first thing, if you're cleared to run by a physician, you want to run. There's no question. And we don't want to hold you back. And so if you start with plyometrics and use that as a screening tool and a way for them to start to build resilience in all of the tissues, that can get them back sooner. And it's also a good educational point where you can say, okay, so we both agree that you can start return to running, but let's make sure you can clear these plyometrics. If you can clear these, then we know that you're really good and we can start sending you on this program. And we have a pretty good return to run program post-stress fracture, but you should be on some kind of return to run program once you're told you can run. You can't just go out there and do it, which is what a lot of people do. And then they end up re-injuring themselves.
Yes, I insist on making a return to run program for all of my patients. I will tweak it a little bit, again, depending on the person. but by no means would I just release someone into the wild.
Even though that's what we want to do, I would like to be clear that we get it. And we also would like to just let you go back and do your thing. But we also know that you will be back in the clinic and injured again if we don't slow you down a little bit.
Right. And I know walk run is so annoying and it's the worst. Like, I get it, but it's just the best way to reintroduce weight bearing, to make sure that we go slowly enough for you to really feel your body. I will tweak this depending on the person, but just know there's a really good reason we make you walk run.
That's the safest way for you to get back. And so introducing plyometrics, introducing a walk run program is how you're going to get back faster. And that's always our goal. How are you going to get back faster and healthier?
The next piece of this is like, okay, let's make sure that we address any of the mechanics that cause this issue in the first place. Why is there increased stress on your tibia, on your femur, in your sacrum, your foot, no matter where it might be? Why is this happening, right? And so the way we do this is with a gait analysis and also a movement analysis in general, which will give us some good information too. Kate, you alluded to this a little bit earlier about, landing pattern can give us a lot of information in terms of why is someone beating up that area of their body more than others. So I know we have gait deviations a little bit further down, but do you want to speak a little bit about why some people might have stress fractures in certain locations?
Yeah. And so the thing that I mentioned earlier, which is the most common area, which is the tibia, a lot of times people will have that narrow gait, so their base of support won't be wide enough. And if you can imagine your foot landing on the outside of your foot, so in a very supinated position, or if you want to say inverted position, if you're landing out there, the force is going all the way up that outside of the leg, creating a lot of torque at the tibia. So that's one thing. If you're not hip extending, I know like hip extension is something that I talk about all the time when it comes to gait. Maybe it's my favorite thing to talk about, but I feel like it's one of the most important things when it comes to run gait. If your hip extension isn't what it needs to be, again, that can load up that leg, and it can load up the lower leg, but it can also impact that femur quite a bit, and even the back. And then again, if you're landing really, really hard on the foot, so if you've got a very strong forefoot landing pattern, or you're like jamming your toes into the ground, or you're collapsing a lot into overpronation and then not really getting out of it, then you're more likely to probably have a fifth met stress fracture. I think those are the big ones.
Yeah, those are definitely the big ones. And kind of going back to the narrow base of support part of this, I actually worked with someone on this yesterday. I put kinesio tape on the middle of the treadmill to try to cue her not to cross over as much. It's more of an instructional thing than really a practice thing, because, you don't want someone like wide stance, like cowboying it up out there, right?
Waddling along with their...
Exactly. So that's not what we're trying to get at. I want to elaborate on this because I actually think it's a really common issue that we see. And it's like, well, what the heck do I do about that? Right. And so, yeah, some of it's being aware of it, but a lot of it is hip strength and control of not only stance phase, but swing phase, which is something we don't talk about a ton. We're always talking about the foot on the ground, and people know about hip drop and things like that. But if you can't control that leg, or your hip isn't strong enough to maintain that straight plane movement before that foot hits the ground, you're going to end up crossing over. And, there's a lot of reasons for this. And that's when you come to us and we can figure out that reason for you. But it is something we see commonly. And if you're landing like right in the middle, like let's say if you were running on the treadmill and you're in the middle, or maybe even on the other side, that just puts a lot of force where we don't want it, where our body isn't ready to accommodate for it.
Yeah. And I would say, again, like if you're running really fast, like 6-minute miles or under, you are going to cross midline. So let's put that out there for some of our elite runners. But then the other piece that might be impacting how you're landing and how your foot is hitting the ground is the mobility at the subtalar joint and the talocrural joint. And so those are the joints that make you point or flex your foot or go side to side. So subtalar is side to side, inversion, eversion, talocrural is plantar flexion and dorsiflexion. And so if you've got a lot of stiffness in that ankle joint because you've rolled your ankle a million times, or perhaps you've had issues with Achilles tendinopathy or posterior tib, any kind of like lower foot and ankle issues, that can put you at risk for a bone stress injury too, just because of the way that you might be landing when you hit.
All good points. And we need to be able to use sort of the full range of motion of all of the lower leg joints so that we don't get caught in that kinetic chain, if you will, right?
Yeah, it's really easy. It's really easy to do. But yeah, gait analysis is definitely an important part, especially when bone stress injury is linked to biomechanics.
We'll spend plenty of time going over that, any sort of running drills or sort of strength activities that we pick up on that might be useful to correct what we saw on the treadmill, right? That's a big part of it too. Beyond this is definitely, and we talked about screening for Red-S and, other physiological reasons why someone might acquire a bone stress injury. Usually there's going to be a multidisciplinary approach in treating it. And we're going to have to bring in some other people. And, Kate, you and I are really lucky in that we have a great community and we have a great medical sort of team surrounding us and some great practitioners that we work with. But I mean, this is including, but not exclusive to, dietitian, sports psych, definitely having a good orthopedic doctor who understands running on board. And then, of course, the coaches and parents communicating how to go back and return to sport and ensure not only that they're in the clear for this injury, but that they don't get injured again.
So Kacy and I are on the panel for the elite runners in the Atlanta Track Club. And we have this really great Wednesday meeting call, which is multidisciplinary. And we've learned a lot from that call. And we really work together to make sure that the athletes have everything they need. And one of the things that has been interesting that's come up as we're all learning to work together is what the medical definition of return to run is and what a coach's and an athlete's definition of return to run is, and having to meet in the middle. And then also looking at what that looks like, the difference between our weekend warriors or our very active and semi-competitive athletes versus our elite athletes. And so that return to run looks very, very different for an elite athlete versus a weekend warrior, but it still has to be at a cadence that makes sense with the physiology. And so what we have been doing and what we're learning on both sides is how to build these return to run programs with the coaches and with the performance team so that we can, one, make sure that our elite athletes are meeting their goals from the elite athlete perspective, but also we're holding them back just enough so that they don't get injured again and that they can fully recover so that they can have a healthy season. And that's been a really, I don't know about you, Kacy, but that's been a really interesting discussion. And I've learned so much just working with that team on bone stress injury.
I totally agree. It has been a really great learning experience, and the language and the communication around it has been really interesting to navigate. Getting an elite athlete back from injury is a lot of the same principles apply, but it is quite different from a weekend warrior or, as my friends and I like to call ourselves, hobby joggers.
Hobby joggers?
Hobby joggers, yes. I know I talk about social media a lot because this is how I like to help people, because this is, where a lot of people are getting their information, right?
This is the reality in our world now, Kacy.
It is. It is. Yeah. And so I will jump on it if I see like a professional athlete talk about their return to run program or talk about their injury return timelines, because they are going to be much quicker and riskier than for the regular person. So I hate having people, read through posts about professional athletes who have had stress fractures and then they're back up doing 12-mile workouts. I don't want to give a timeline, but soon, like very quickly. And it's just not realistic and it's just not typical for most people. So I don't want people thinking that they're behind because they read things like that on social media.
And I think that's a really good point. Everybody heals differently. And if running is your job, you're going to have a different team and support system than those of us that running is our job, but you know what I mean? But we're on the other side of it. Yeah, the other side. So you'll have a different support system. And so you won't have the same things available to you. So you probably can't go as quickly back into it. And so you have to think about things like nutrition, and diet is very, very important when you're thinking about returning from any injury, but particularly a bone stress injury. And so if you're not thinking about how or changing your diet to mimic your recovery, then that's a big deal. And so professional athletes often have someone helping them with that, which will increase their timeline. And then of course, they've got a coach with them who's helping them and watching them. And they often have athletic trainers that are there every single day. And then hopefully they have, an MD and physical therapist as well, like our athletes do.
That's why I think we take it upon ourselves to create some sort of a team for our patients, because it is the best way to get them back healthy and hopefully to prevent, issues in the future. And yeah, I think expounding on the dietitian piece here is important because not only from a quality perspective, right? So if there's some sort of deficiency in iron, ferritin, or vitamin D, anything that maybe blood work that has been done over this course has told us, a dietitian can be really helpful to make those tweaks so that the person can meet those needs and address any deficiencies that might have caused the bone stress issue. What's really important is not to restrict food during this time and to actually eat a little bit more than you think you do, because it takes energy to heal an injury. And this goes with any injury, but I think it's especially important for bone stress injuries because any little bit of deficiency or any little bit of underfueling in this period is going to make your recovery longer. Not only in, maybe the time you get the clearance to run, but you might, once you come back to running, you might end up with some soreness or some, nagging sensation in that area because you aren't completely healed, even though timeline and everything should indicate that it should be. So just a big shout out and plug for a sports dietitian in this case.
I think it's really important. I know that on our Precision Performance website, if you go to our blogs and you look up fueling during injury, I think we do have a really great blog from a local dietitian writing about what kind of things you need when you are injured. But there are also other people out there, a lot of other really good people out there that you can tap into their knowledge, but it is an important thing. The other thing that I think we need to talk about is timeline. You mentioned it briefly that every timeline is a little bit different, and timelines for elite athletes might be shorter than timelines for hobby joggers. Is that what you're calling yourself?
Yes.
That's really funny. Jogger. That should have been in this episode slaps, because I didn't know about hobby joggers.
You seem very surprised about this, but yeah, this is what us common folk call ourselves.
But when it comes to timeline, we have to think about how long does it take for bone to heal? And we know that bone takes at least 8 to 10 weeks to heal, at least with the best conditions possible. And so usually what happens when you have a bone stress injury is that you will have some kind of imaging in the beginning, and then about 8 to 10 weeks out, if everything is feeling good and you're having less pain with weight bearing and you're doing everything you need to be doing, perhaps you rested it in a boot or on crutches, whatever, they'll do another image and look and see if that bone has actually healed or not.
That's why I don't like to give any specific timelines, because it does vary person to person, and something we lean on our physicians a lot to help sort through that depending on severity of injury and things like that. 2 cases where I would recommend going really, really slow are the more vulnerable populations that we talked to at the top of this episode. So people with Red S who may have had amenorrhea for some period of time. And we did touch on this with Dr. Gleason as well, in terms of, how well matched or maybe how poorly matched, resuming regular menstrual cycles, and then the lag that there might be in actual bone density and bone health once an athlete resumes a regular menstrual cycle after losing it for a certain period of time. So that would be something that we would want to work with a physician to get the all clear on that aspect of it as well. And then, of course, our postpartum moms who are breastfeeding, we want to go a little bit slower with them as well, because they're still drawing from their bones if they still are breastfeeding, or kind of looking at that timeline of from when they had their baby to when they ceased breastfeeding and so on and so forth?
So I guess the bottom line is it varies and it depends, which is the worst answer we could possibly give because it's annoying and frustrating, but that's the truth. And we do our best to make things as easy and straightforward as possible on this podcast and in our practice. But sometimes the answer is it depends.
And I don't think most people try to heal stress fracture or to treat stress fractures on their own. But just the importance of having a team around you to look at all of these factors for you, right? Because the last thing you want to do is wait 6 weeks of no running and then end up with another injury very shortly after because you were impatient or didn't have the right guidance. So as hard as it is, and like I think stress fractures are one of the most, I don't want to say one of the most, but all injuries are emotionally draining. I think stress fractures are kind of a special breed. And once someone gets one, the fear around it is a huge hurdle to climb over as well. Taking the time when you do get injured to check all of your boxes, I think is really, really important.
You're right. All of that is very right. But the other thing I want to say is that bone is one of the only tissues in the body that heals 100%. So if you have a stress fracture, it doesn't mean you're going to have another stress fracture, especially if you've addressed any issues that are underlying, whether it's RED-S, nutrition, or biomechanics. If you've addressed those things, it doesn't mean you're going to get another stress fracture, and stress fractures heal under the right conditions. So it's funny you said you think that bone stress fractures are one of the worst injuries. I'm always like, this is great. It's a stress fracture. You're going to heal in this amount of time and is usually within this range. And we know it'll heal 100% if you do the right things. It just depends on your perspective and kind of where you are in your career and how many injuries you've had. But I do think that knowing this is something that can heal 100% if you've got the underlying issues taken care of can be relieving, actually.
I love that perspective. And now I feel like a terrible person. So I feel bad because no, all of that's right. I was speaking from a psychological standpoint because the process is so much and it is like complete cessation of activity. I just know that a lot of people have it in their back of their mind when, they do return to run. And this is like any injury, but I see more of a psychological stamp put on bone stress injuries. You're right. There is a relief that comes with that because it's like, okay, we know what it is. It has a defined timeline and it heals 100%. So thank you for putting a bow on my pile of garbage. I appreciate it.
But at least it's not a pile of poo.
Well, I was going to say that, but I was trying to be more podcast appropriate.
On that note, Kacy, I think that we are almost done here.
I think so too. And I actually think this has been, I'm really excited about this series of podcasts, actually, because I think they go really well together. It's a wealth of information, in my humble opinion.
As always, I love talking to you, even though I talk to you every single day, multiple times a day, and text you in the middle of the night. If you guys ever have questions, please reach out. We love to talk about this stuff, but we also like to answer questions. And if we can, we're happy to do episodes about topics that you're interested in, because this is all we do all day long is treat runners, talk about running, write articles about running, like we're in it. And so if you need something, you let us know. Thank you so much for joining us today. We hope that it resonated with you and that you learned something. If you enjoyed this podcast, please rate and leave us a review wherever you get your podcasts. It really helps increase our visibility within the platform so that more awesome people like you can find us.
If you'd like to support us further, pretty please, you can visit our Patreon page at patreon.com/morethanmiles. That's www.patreon.com/morethanmiles. Or for a few dollars, you can help the show grow and keep going, as well as receive exclusive perks like monthly Q&As with us. Until next time, remember to run the mile you're in, and that training is so much more than miles.